Hello, I'm Lynn Doyle. Thank you for joining us here on Meet the Doctors. As you know, each week we look at important health news, medical breakthroughs, and alternative therapies and how they may impact you and your family. We explore the facts so that then you can make educated decisions. Coming up today, there's been plenty of ugly headlines about professional athletes being accused of domestic abuse, among other violent acts as well. Can brain injuries on the field be linked to violence off the field? We'll be talking to a leading neurologist and a consultant to the NFL about her research on that very topic. And can you fully recover from a stroke? Now, thanks to cutting-edge technology, you can more frequently. We're going to hear more on that important issue. And then, of course, we'll have our panel of doctors to be answering your email questions. But first, the news. There is an enormous medical breakthrough. A new drug used to treat advanced breast cancer has had an unprecedented success in prolonging lives in a clinical trial. Patients who received the drug, called Perjeta, had an average survival time almost 16 months longer than those in the control group. That's the longest amount of time for a drug used as an initial treatment for metastatic breast cancer, and it may actually be the longest for the treatment of any kind of cancer. Most cancer drugs prolong survival in patients whose cancer has spread to other parts of the body for just an average of about 2 months at best. Perjeta, known generically as pertuzumab, blocks the action of a protein called HER2, which spurs the growth of some breast tumors. Perjeta is used with another breast cancer drug, Herceptin, for the roughly 20% of breast cancer patients with HER2. A patient continues to be treated for Ebola at a Dallas, Texas hospital. It's the first case reported in the U.S. according to the Centers for Disease Control and Prevention. Now, so far, the virus has been centered in West African countries, although some Americans fell ill working in the affected countries. They were, however, successfully treated back here in the States. Ebola is spread through direct contact, through broken skin or mucous membranes with blood or body fluids of a person who's sick with it. Symptoms include a sudden onset of fever, weakness, muscle pain, headaches, and a sore throat. Now, these symptoms can appear 2 to 21 days after infection. Ebola can only be definitively confirmed, though, by 5 different laboratory tests. A brain chemical may help people with Tourette syndrome suppress the tics that trigger violent movements and obscene outbursts. Researchers believe Tourette's is an imbalance in certain brain circuits, which results in jumbled, noisy messages being sent to areas of the brain that control our movements. Now, this could be a much-needed breakthrough for people who suffer with this horrible neurological condition, like John Davidson, who has lived with it since he was a teenager.
All right, the next time you feel you're going to sneeze, no, try your best not to sneeze. Eventually you have to sneeze. And that's similar to what it's like. You know that it's coming, you're trying to stop it, but you can't. Sorry. Sorry.
Thank you.
Hello dear, how are you doing? It makes you feel really, really embarrassed sometimes. It can make you feel ashamed. Sometimes you feel guilt for no reason.
At the University of Nottingham in the UK, scientists took brain scans of 15 teenagers with Tourette and a group of teens without the disorder. The investigators found that the Tourette group had higher levels of a chemical inhibitory neurotransmitter called GABA in one area of the brain. Now, the supplementary motor area is involved in planning and performing movement. Non-invasive brain stimulation has been shown to boost GABA in targeted brain regions, though not in people with Tourette. But a technique called transcranial direct current stimulation, or TDCS, is now being tested to ultimately slow down the response to Tourette in order for the patient to naturally gain control over their tics. According to the National Institutes of Health, about 200,000 Americans have severe Tourette symptoms, while up to 1 in 100 have milder tics. Researchers have discovered an early warning sign in people who went on to develop pancreatic cancer. It's an increase in levels of certain amino acids. The findings came from analysis of blood samples from 1,500 people taking part in large health tracking studies. As you know, most people with pancreatic cancer are diagnosed after the disease has reached an advanced stage, and many die within a year of diagnosis. Gastric bypass surgery is more effective than gastric banding for long-term weight loss. That's according to a new review of 30 long-term studies. Gastric bypass is when surgeons create a smaller stomach pouch and then reroute food to bypass part of the small intestine, while gastric band, a less severe procedure, installs an inflatable band around a portion of the stomach that can be adjusted to limit food intake. Now, with both procedures, patients feel fuller more quickly, and therefore they eat less and consume fewer calories. People who underwent gastric bypass surgery lost more weight, an average of about 66% of their excess weight, compared to 45% for those undergoing gastric banding procedures. Well, you'll like this. Pope Francis recently made a confession. Yep, he said that he relaxes with a drink every day to calm his nerves. And no, it's not an alcoholic drink. It's called yerba mate, and it's a popular South American herbal drink. It's actually made by steeping the leaves and stems of a native tree from South America. And traditionally, it's served in a dried gourd and then sipped through a silver straw with a filter on one end to strain out those leaves. It's not known if the pontiff prefers it that way, but to tell us more about this centuries-old elixir is our own Newsmax Deputy Health Editor, Nick Tate. Nick, it sounds like this is something sent from the heavens.
You know, it's been used for centuries as a stimulant, and it does in fact contain caffeine, but it's also loaded with vitamins, minerals, antioxidants, amino acids, and other healthy compounds that lower inflammation and boost the body's natural functions. A recent study by the Pasteur Institute found that it contains, quote, practically all of the vitamins necessary to sustain life. And those who drink it describe it as a kind of herbal multivitamin drink. Now, Pope Francis told reporters that it helps him calm an undisclosed nerve condition he has, but there's pretty strong evidence that it also has a range of other health benefits, Lynn.
Well, you know what they say, when in Rome. Next up, each year approximately 795,000 people suffer a stroke here in the U.S., but major medical advances now help lower serious long-term disabilities. We're going to talk about what those advances are right after this. Stay with us. Welcome back to Meet the Doctors. I'm Lynn Doyle. Did you know that more than 140,000 people die every year from a stroke in the United States, and that it's the leading cause of serious long-term disability here as well? 795,000 people will suffer a stroke, and about 600,000 of those will be having their first one this year. Here to tell us more about it and what we can do to prevent it and to treat it if it happens to us is Dr. Ravi Rajmani. And I'm so glad to have you here because this is a subject that has interested me for a very long time. It's nice to have you back with us.
Thank you, Lynn. Great to be back.
So tell me, what happens to us when we have a stroke?
So a stroke, simply put, is really a catastrophe, a catastrophic event in the brain. And think of it as a brain attack, really. There are different ways that the brain can be so-called attacked. And it really has to do with blood flow to the brain. As you can imagine, blood flow to the brain is essential for delivering oxygen. So if there's a disruption either from something that prevents blood flow in an artery, that's usually an obstruction, or something that causes the artery to rupture, both of those mechanisms, and that's a hemorrhagic stroke. So two quite distinct types of major strokes, a hemorrhagic versus an occlusive or an obstructive.
But both of them can be debilitating or even deadly, as we pointed out.
Absolutely. And so, you know, some folks use the term ischemic stroke to describe the obstruction, and I think that's sort of a misnomer in the sense that certainly if you bleed and flood an area with blood, you're disrupting the blood supply, and you have a relative lack of oxygen, you have ischemia, and you have essentially loss of function and great disability.
What are some of the symptoms if people suspect that they may be having a stroke?
So that's a great question, Lynn, and I think it's important for not only patients but also family members, kids, grandchildren to recognize these risks or these signs in older folks or actually at any age. Stroke can occur at any age. So if somebody, for example, has suddenly garbled speech or slurring of their speech, if there's some sort of facial asymmetry where one side is drooping, certainly if there's weakness or tingling in a side, vision changes are also characteristic of some types of stroke. And also somebody with an unsteady gait who doesn't quite look right. You know, if there's a question and a patient has risk factors such as hypertension, diabetes, high cholesterol, certainly I would get that person to an emergency room to be evaluated by a provider.
And getting them to the emergency room, or preferably a stroke
Stroke
center,
great, yes.
is important, because time when it comes to a brain attack or a so-called stroke is of vital importance here.
Absolutely. Time is brain. And in New York State, for example, I am part of a registered stroke center, and we are required each year to acquaint ourselves and really master the latest treatments for an acute stroke. Certainly, the greatest innovation that we have now is reperfusion. Reperfusion by using something called TPA, which is essentially a clot buster. It essentially, for those patients who have the obstruction, that can actually dissolve the clot. And that should be given within 3 hours, preferably, of the onset of symptoms.
So this is not one of those situations where you say, I'm going to wait a while and see how I feel. If these symptoms present themselves, it's better to be safe than sorry.
Absolutely. Time is brain, and time is function. And if you're unsure, and again, I'm pleading to folks, family members, friends, if you're unsure of something, and there are certainly stroke mimics, just come again to the emergency room and have a provider evaluate you.
I said at the top of the segment that it was a topic that I was very interested in, sure. And personally, my grandmother had a stroke, and so I wonder if it's something that is genetic, that I may be predisposed to. And one of the very first interviews that I ever did in my television career was with the actress Patricia Neal, who suffered a devastating stroke and then was out for about 10 years, but was able to come back. Are people able to recover, and do they recover better today than perhaps they did when my grandmother or Patricia was stricken?
Absolutely, that's a great question. And I think we recognize stroke early, so there is a role for intervention. I think there are novel ideas about how to reperfuse the brain. Some of these are more aggressive and they're not quite ready for prime time. So not only can we identify strokes earlier and prevent them by giving medications that will change the milieu in the brain, but I think we also are better at rehabilitation and better at recognizing what sort of collateral flow there is to certain parts of the brain and anticipating recovery. So certainly it's a multi-pronged approach to recovery, but I'm hoping that we're making progress.
It certainly sounds as if you are. Now, I know that a lot of people suffer migraine headaches, and a lot of the symptoms that you described for a stroke mimic migraine headaches. Is there a connection to have been found between the two?
So that's another fabulous question. And then, so migraines now, as more and more work is being done on the etiology, meaning the causes of migraines, we realize that it's a change in the vasomotor tone in certain blood vessels. And we know that we can manipulate that or actually reduce some of the spasm. For example, Botox injection has been used effectively to treat migraines. And essentially what it does is it just prevents the spasming of those vessels in that area. But certainly if you are an individual who has migraines and your migraine attack is a little bit atypical this time, I certainly think having somebody else evaluate you is a wise idea.
You mentioned having some of the precursors to stroke, but is stroke the kind of thing that can happen to anyone at any time, any age, any gender, any race, any ethnicity?
Absolutely, and every week in our ICU we see great tragedies. Last time that I was on call in the ICU, I had a young gentleman who was coming back with focal weakness of an extremity, and we were talking to him. He had essentially a hole in his heart that permitted this happening, and I asked him, how do you know this is a stroke? Because I wouldn't think a teenager would be aware of this terminology. He said, oh, I had my first one at the age of 15.
Oh, no.
So that was quite humbling. Again, certainly kids are not at as high risk as older folks, but any patient, any race, any gender, any socioeconomic background.
I can't let you go without you giving us some advice on what we could be doing to try to prevent ourselves from having a stroke.
So I think the most important tenet of stroke prevention is blood pressure, trying to make sure that you have normal blood pressure. Blood pressure is essentially the cause of most hemorrhagic strokes. And then the flip side to that is most obstructive or ischemic strokes often are caused by cholesterol deposition. So controlling cholesterol levels. I think certainly diet and exercise greatly impact on both of those. You know, that's to eat well, eat moderately, and living well is, you know, the sort of answer to everything. But when you need help with medications for cholesterol, seek that out.
Great advice as always. Thank you, Dr. Rajmani.
Oh,
Good to
I'm
have
delighted
you with us.
again. Thank you very much.
We'll take a quick break, and when we come back, we'll talk about brain injury and whether or not it impacts your behavior elsewhere. Stay with us.
Each concussion got worse, as the doctors have talked about today. My third concussion was simply a player jumping over me in pursuit of a tackle as his foot lightly grazed my helmet. And I have no memory of that. It was the first time I'd ever experienced amnesia. Then there are behavioral changes. There is hearing my 5-year-old daughter tell our family practice doctor that at times she's afraid of me.
That was former NFL tight end Ben Utecht telling a Senate hearing on aging this summer that he started experiencing memory loss at the age of 29 after a football career in which he sustained 5 concussions and innumerable hits to the head. The American Brain Foundation and the American Academy of Neurology have named him their national spokesman as they try to educate the public more about the effects of traumatic brain injury. We now turn to Nick Tate once again to talk about brain injuries and whether they can be linked to violence. Nick?
Well, hey, Lynn, you know, the recent revelations about Ray Rice are only the latest in a string of cases that have really raised questions about whether contact sports cause brain injuries that predispose some athletes to commit violent acts. Now, NFL players obviously suffer repeated blows to the head as part of the game, and there's ample conclusive evidence that all those hits to the head increase the risk for a variety of brain disorders, including dementia, Parkinson's, and Lou Gehrig's disease. But there's also a growing body of evidence that suggests that brain injuries can also increase some players' propensity to commit domestic violence. Research out of the University of Pennsylvania and Boston University has found that football players often have certain types of brain damage that's been linked to aggressive behavior and violence. And we know from crime statistics that domestic violence arrests are 3 to 4 times higher among NFL players than in the general population. Now, we need to be clear here, brain injuries are not an excuse for the dozens of NFL players who've been arrested for domestic violence in recent years. And these guys are trained to be aggressive and are rewarded financially for it, which may also contribute to a culture of violence that can spill over from the field into personal lives. So it's a complicated issue and a complicated question, Lynn, and I think that more research that's being done will give us some of the answers we're looking for here.
Thanks, Nick. And it's research that we're going to talk about now with our next guest. This is Dr. Tina Shetty. She is both the neurologist for the New York Mets and an independent team neurologist for the New York Giants. She's investigating the effects of brain trauma in athletes, and her research in head trauma involves brain imaging after repeated concussions or mild traumatic brain injuries. Dr. Shetty, thank you so much for being with us.
Thank you.
I'm certain that you were watching very closely the news headlines these days indicating that perhaps some of these athletes who are now tied to violent acts may be the very subjects of what you are researching.
We're looking at acute concussions, and we're trying to track those over time. So understanding the effects of concussions on the brain is very important to understanding whether or not violence could be a consequence of traumatic brain injury. That's certainly something that is not yet well understood. We cannot make any conclusions about that at this time. However, we recognize what the acute symptoms of a concussion are, and we're trying to see how concussions evolve over time. And we're trying to capture biomarkers for concussions over time.
Let's talk about the symptoms of a concussion, because it's not just the athletes on the field or on the rink or on the ice, but it's also our children and grandchildren who are sustaining them in after-school sports as well.
Right. And the symptoms of a concussion can range. There can be a tremendous variety of symptoms. They can be as simple as headache or head pressure. There can be a sense of mental fog. There can be a feeling of confusion. There can be an imbalance or unsteadiness. There can be a sensitivity to light or noise. There's a whole range of symptoms that one can experience. There can also be emotional symptoms. Symptoms like anxiety, depression, or sadness, or even irritability. So it's very important to be aware of what these symptoms are so that we can teach the public, athletes, sports, people in sports, and children what these symptoms are and how to recognize them when they've had a concussion.
It always amazes me that someone who sustains a concussion is willing to go back out and play another sport or engage in the same kind of activity, because I would be so sensitive and so nervous to experiencing that same kind of pain again. And yet you see it repeatedly. It's not just one concussion. Many times it's numerous concussions that a person sustains.
And this is exactly the concern that we as physicians caring for concussions have. The most important thing we can do is educate people about what a concussion is, and also educate them about when it's important to stop playing and be evaluated by a physician or someone who understands concussions.
When is it time to stop?
I would say anytime somebody is hit on the head and they're having any kind of change in their mental awareness or any one of these symptoms that we describe, it's very important that they at that point are removed from the field and they're evaluated by a professional who is trained in concussion management.
Concussion management. Can you actually manage a concussion? Can you treat a person who has sustained a traumatic brain injury to the extent that they can continue to function normally?
In the acute setting, immediately after concussion, it is very possible to treat someone. And the cornerstone of concussion management is both physical and mental rest. After some time, when someone's had repeated concussions, and if they have a cumulative kind of brain injury, at that point it becomes much more challenging to treat them.
This is a challenge that professional sports deals with day in, day out, week in, week out.
Correct.
And I'm wondering what you would advise the NFL when it comes to these continued concussions, these continued brain injuries. Would you suggest that they come up with a policy that says after a certain number you can no longer play?
I wouldn't suggest exactly that, because I believe that concussions are very individual. We recognize as physicians who treat concussions that each concussion is different. One concussion in one player may be very mild, another concussion in another player may be much more severe. It may have taken that player much more longer to recover from their concussion. So that constitutes a risk factor for subsequent brain injury, which may be an issue, whereas another player may recover beautifully from their concussion and go on to play without any kind of consequences. In terms of advising the NFL, I think better guidelines, better management, and I think they're very much trying to do this. It's very important to educate the trainers and the coaches and to have everybody collaborate and to advance research and science. That's really where the answer lies.
There is actually a suit that involves some 4,500 former NFL players. Do you know the long-term effects yet of traumatic brain injuries or so-called concussions, or is it still research that's being conducted?
We do not yet fully understand the long-term implications of multiple subconcussive blows. We don't understand the complications that may or may not happen from long-term effects of concussions. So we're still very much trying to get clarity on that. And the answer really lies in the science of this.
Why do you think it is now that we seem to be so much more aware of these traumatic brain injuries?
I think there's a great deal of awareness now. I think for a long time this was something that was unnoticed and unrecognized, and that was a big problem. And I think it's great that people recognize now the importance of both detecting and diagnosing these injuries and also managing them correctly. And I believe that's because it has been brought to attention with professional athletes and the rise of knowledge of things like chronic traumatic encephalopathy, which again we're still trying to understand that entity and what becomes a risk factor for it. That's not something that's well understood. There's a lot of hysteria, I think, about concussions right now. So I think the best approach is really to try to manage them very safely, as cautiously as possible, and to try to better understand the science.
3 words I never want to hear: traumatic brain injury, when I'm speaking about my children or my grandchildren. Thank you so much for sharing your perspective on it for us.
It's a pleasure.
And we're going to ask you to stay with us and answer some of our viewer questions.
Of course.
That'd be wonderful. We'll take a short break, and that's exactly what we'll do when we come back. We'll have our Newsmax doctors here, and they will be answering your email questions. So stay with us for that and much more. We'll continue right after this. Welcome back to Meet the Doctors. I'm Lynn Doyle. This is one of our favorite segments here because we actually have an opportunity to hear from you. We put together a great panel of doctors, and then they answer as many of your questions as we possibly can. Let me reintroduce them to you. Dr. Tina Shetty has rejoined us. She's a neurologist at the Hospital for Special Surgery. We're now joined by Dr. Erica Schwartz, who, as you know, is an internist and an expert in wellness and prevention. And also rejoining us is Dr. Ravi Rajmani, who is a pulmonologist. So it's great to have you guys together. You ready to answer some questions for us?
Sure, ready to go.
Our first one is for you, Dr. Shetty, because after what you just told us in our last segment about brain injuries and concussions, we have some viewers who are wondering whether or not their MRIs are showing signs of concussion. What would a viewer look for or ask their doctor to look for in an MRI?
An MRI, a routine brain MRI, is typically normal after a concussion. An MRI is designed to look at the soft tissues of the brain, so it's different to a CT scan, which would be better to pick up something like blood. The MRI is in fact normal after concussion, which is very puzzling, I think, to both patients and their physicians, because after one has a blow to the head, one would imagine that the MRI would be abnormal, but in fact it is usually largely normal.
And you're actually using MRIs as part of your research.
Yes, I am. So right now we are doing research whereby we're recruiting patients into our study who are between the ages of 15 and 50 and have had a concussion within 72 hours or 10 days. We then bring them in and we examine them and do a neurological evaluation and a concussion evaluation, and we then do a special MRI, which is a research MRI, and has some advanced techniques which have been designed to try to detect the the changes that happen in the brain after a concussion.
We're getting a lot of questions from parents who want to know if you oppose contact sports for their kids. What would you suggest?
So that is not a decision that would ever be made lightly. It's a very difficult one. Contact sports are a very important part of our youth, and it is something that's based on things like how severe the history of concussions are, how severe the actual concussion was, how long it took a patient to recover from that concussion, and how many concussions they might have had.
But you're not necessarily saying that kids should never go out and have any kind of physical or contact sport.
Not at all.
Okay. So we're going to have to leave that to the parent to make the right decision. But we always like to have your input. Dr. Rajmani, we have one for you. Sure. We were talking about strokes earlier in the show. This viewer asked, is it possible for stroke dementia to be mistaken for Alzheimer's disease?
So that's a great question, and certainly we know that the most common cause of dementia in the United States is probably due to vasomotor or vascular types of dementia. The Alzheimer's dementia is a different type of dementia, and certainly Dr. Shetty can probably speak to this, which has more to do with the cholinergic tone in the brain. And so it's not necessarily as a result of an ischemic event or some sort of occlusion in a brain vessel. There's also differences in types of dysfunction you have. With Alzheimer's dementia, there are some short-term memory losses, and some of the more sort of motor functions decay at a later time. Would you add anything, Dr. Shetty?
Yeah, just that there are many different kinds of dementia. You know, Alzheimer's is one of the most common ones, which usually presents with short-term memory loss, but there's also multi-infarct dementia related to, like you suggested, vascular issues like multiple strokes. There's also frontotemporal dementia, which can be present with personality changes and disinhibition.
Okay.
So there is a whole variety.
As you know, we could speak on strokes for an entire segment. We're going to make sure that we continue to follow that. Now we're going to ask Dr. Schwartz a question. Do statins actually cause ALS or Lou Gehrig's disease?
So this is like a totally neurologic conversation here. And I'm sitting here and I could bring in prevention as a conversation piece. Well, first of all, there's no study that really connected amyotrophic lateral sclerosis or Lou Gehrig's disease to statins. However, having said that, statins are known to have side effects where you develop muscular weakness, you get all kinds of muscular dysfunction associated with them. So while you don't have the label of ALS with it, I think that whenever there is any muscular weakness or problem, a doctor has to be contacted and they should investigate any kind of muscular problems secondary to the statins.
Since you mentioned prevention, this is a great question I want all of you to comment on, but I want to start with Dr. Schwartz because it's flu season. People want to know about the flu. Is there anything we can do to avoid getting the flu?
Of course, wash your hands, stay away from people who have the flu, and make sure that you don't spit and you don't go to work when you get the flu. So this way you actually will protect the people around you and yourself.
Okay.
The other thing is there's a whole issue about flu vaccines, which we can discuss because they're pluses and minuses. And although we are so freely giving flu vaccines to everyone and everything, it's not necessarily as clear cut as we make it.
Well, let's start with the elderly population. Dr. Rajmani, would you suggest that people of a certain age always get the flu vaccine?
So my perspective, of course, is as a pulmonologist and an intensivist. So I would have to probably differ a bit from Dr. Schwartz, and I really am a wide proponent of everyone getting the flu vaccine. The CDC says anyone older than 6 months should get the flu vaccine. I think certainly older folks are people who have more serious diseases, and folks who are 65 or over are the greatest risk for having catastrophic illness and respiratory failure. So actually the CDC recommends a higher dose trivalent vaccine for those older folks.
Well, I think actually, let me balance that. And let me explain to you that, first of all, flu vaccines are developed out of pretty much guesswork, and they're all based on statistics. So when we develop a flu vaccine, it's based on the statistical data on what happened years before as far as flu vaccine is concerned. So we don't always kind of hit it right. The other thing is we don't know what year it will be that the flu vaccine that is a specific strain of flu will affect correctly the person. The downside of the flu vaccine is also the fact that it affects your immune system. And there are people who report taking the flu vaccine and getting the flu.
Well, that's the biggest fear that people say they have.
Right.
I don't want to take the flu vaccine because I get the
right,
flu.
but this is the thing. So there are also studies that have shown that people who've taken the same vaccine sequentially for more than 10 years or so may have an increased incidence of neurologic problems. But the problem is that it's an individualized medicine issue versus a public health issue.
Okay.
And public health is what we're talking about in statistics and acute care, and individualized care is what we're talking about in prevention.
Okay, we're going to give you the information and you guys can decide what you'd like to do. We're going to take a short break, but we'll have more of your questions right after this. Stay with us. So what's great about Meet the Doctors is that when you meet the doctors, sometimes they don't always necessarily agree on everything. And we were just talking about the flu and flu vaccines. Dr. Rajmani, you don't necessarily agree with Dr. Schwartz on all points when it comes to who should get it and how important it is.
Certainly, I think with any medication, there's risks, and it should be a risk-benefit assessment. But I think the influenza vaccine, I sort of quibble with the idea that it's a roulette game in terms of what we're going to find as a pathogen. Certainly there are many strains, and it's a statistical model based on probabilities of what will affect this area.
Well, let me ask you this. Sure. Will you get a flu vaccine?
Absolutely, and in fact, practitioners, most of us who work in hospitals, are mandated.
I was going to say,
that's why.
You as well?
No, I won't take a flu vaccine because I don't work in a hospital. And when I worked in the hospital and I was working in critical care, we had to take the flu vaccine, and I actually gave the flu vaccine to thousands of patients.
And Dr. Shetty?
And when you work in a hospital, you have
Yes, it is
to.
mandated.
It is
in the
mandated in the
for special
hospital.
Because
surgery
you're
where I work.
exposed.
Yes.
So-
Because of the exposure.
Another-
It's public health.
Another viewer question is, how long are you contagious once you actually do have the flu, whether you've taken it or you haven't? You get the flu. How long do you have to stay home from work or out of school?
Well, I think as long as you have acute symptoms. So if you're coughing, and if you're spitting, and or you're vomiting, or you have stuff coming out from both ends, and if you have a fever. 24 hours after they have a fever. So
Okay.
those are the times that you're really infected. And you should watch your family and follow really strict hygienic rules so as to not infect the people around you.
So all those people out there who insist on going to work,
You're not
and all
helping
those
anybody.
bosses who insist on making people
Right.
come to work when they have this, don't do that.
No.
None of us want to share with you.
You're not helping anybody.
Okay.
You're spreading it.
You're
You're
spreading
creating
it.
an epidemic
Okay.
instead of containing
We don't
it.
want an epidemic. Okay, let's move on. We have some other questions. Dr. Shetty, I was recently told that my findings may have found chronic small vessel disease. My doctor ruled out that I had not had a stroke. I have currently no memory problem. I'm not overweight. I'm not a diabetic. Should I be concerned about a risk for dementia?
I would explain this and tell you that chronic small vessel disease is a finding which is a risk factor for neurologic complications down the line. One of those could be something like dementia. However, a risk factor is just that, and it's one risk factor. It's an isolated risk factor in the same way that hypertension, cholesterol, diabetes are risk factors for heart attack.
Okay.
A risk factor is very much something that can be modified. So the isolated risk factor of small vessel disease, whilst it should raise some concern to lead a more healthy lifestyle and modify the other risk factors, is not a reason to believe that one is going to end up with dementia or cognitive decline later in life.
Okay, that was a very succinct answer to a very complicated question. Thank you for doing that. Do you, Dr. Rajmani, know about a drug called Intercept that's somewhat controversial? We have a question about
Sure.
it.
So it's interesting that came up. Certainly, a stroke is devastating, and there are long-term effects, most of which are not reversible. Unfortunately, if you miss that window for the TPA, many of these deficits are permanent. There have been a variety of new medications that have been proposed, primarily outside of this country. So Intercept, which is Enbrel, which is it's a tumor necrosis factor inhibitor. It's used for rheumatologic disorders. So it has anti-inflammatory properties, has been used by some providers to theoretically reverse the effects of a stroke, whether this is by anti-inflammatory mechanisms, that makes a little bit more sense to me, or reperfusion, that doesn't make sense to me, is debatable. It's certainly not FDA approved and not ready for prime time.
Okay, we are going to talk more about that on a future edition of this
Sure,
show, because a
sure.
lot of people are
Interesting
interested
topic.
really about that whole concept that you could administer something and literally within minutes have a patient back relatively
But we have
to
that
normal.
already, right? Don't we have that already?
with
yeah.
TPA.
Of course, a TPA. There is a drug that don't hear.
Which is not, but the indications for TPA can be complex. It has to be given within a very tight time window, so that it's not always a magic cure for stroke, but it certainly is offered when it's appropriate.
Earlier in the show, we talked about strokes and how important it is to get to the hospital within a very short window of opportunity.
Yes.
And the expression that you use, time is brain, it has stuck in my brain now. If there's any symptom of anyone that I know, I'm going to insist that they try to get to a stroke center. I'm going to thank you all for being here. Dr. Ravi Rajmani, Dr. Erica Schwartz, and Dr. Tina Shetty. We certainly appreciate your perspective, and we always remind our viewers that they should take your advice and then talk to their own medical professionals. Thanks so much for being with us.
Thank you.
And of course, thank you guys
Thank
so
you.
much for being with us. We'll see you on the next edition of Meet the Doctors. I'm Lynn Doyle. Have a great one.